After spending a lot of years as a doctor in other medical settings, what made you make that decision to become an entrepreneur and open Windermere Medical Center?
Well, everyone's going to think they heard how much housing is happening, how many families are moving in, the growth that was happening in Windermere 535. But I live in Windermere, and I used to drive down 535, go to Popka Island, and I'd see that there was so much growth, but there was one thing that's lacking. There was no medical facility. There was probably 2 other medical facilities that are owned by hospitals, but there was no other medical facility. So, just by lack of access to medical care, I felt like healthcare was changing, new healthcare rules are coming into play, and one of the things that I really felt passionate about was the family is basically having to figure out what they need to do with the changing healthcare. So the best way I can set this up is I'd like to tell you a story that most of you are probably familiar with, probably experienced on your own. So a patient with a history of hypertension calls his doctor because he's got now cough and a fever, has run out of his medication. Calls the office, says, "Doc, I need an appointment." Can't get in for 2 weeks. So he's like, "Okay, well, what should I do?" He ends up going to an urgent care center. Well, before he walks in, he's going to have to pay higher money, a higher copay, just to go to that urgent care center. Gets discharged with bronchitis. He's told, "Go see a doctor in the next 3 days." The guy says, "What's the chance I'm going to get an appointment because they just told me I can't get in for another 2 weeks." 5 days later, he's feeling worse, ends up going to the ER. In the ER, diagnosed with pneumonia, gets hospitalized. So you can see the trend. Lack of access resulted in that patient now paying thousands of dollars only because he cannot get into his doc. So one of the biggest problems with healthcare now has become the lack of access to care and also the lack of full coordination of care. So these were things that I kind of said, you know what, I have a good job, but if I'm going to do something, we're going to do something different. And so that began with 2 things that I focused on. One was, we're going to give access to patients if I build this facility. And we're going to coordinate the care better. And secondly, I'm going to focus heavily on saving the patient money, because no one's really looking out for the patient. And I'm going to give you some examples of how we implemented that. So my facility, Windermere Medical Center, is located on 535. I have internal medicine, pediatrics, chiropractic services, all in one facility. This is meant to make your scheduled appointments, and so you can have all your preventative care and continuity of care. The other thing I did is I built a walk-in center. The walk-in center is open 6 days a week, 9 to 9, Monday to Friday, Saturday 9 to 5. This was going to give that access to care to the patient, so they would not end up in an urgent care. They would not end up in an ER just because their doctor is not open. So just with that, we said, let's take it a step further. Let's bring more services to the center. So we basically bring in, we've got X-ray services in-house, ultrasound services, echo services in-house. That same service costs less money to the patient today than if they went to an outpatient imaging center or worse off to a hospital facility. So by reducing the cost, but more importantly giving them access, the patient's actually getting better health. And that's one of the things where, yes, there's a housing boom development going on, but who's really giving the patient what they need? And I feel like at this point, there should be more people. One of the things we will ask is, can people adopt this and maybe make this more successful so that we can get this growing community something, not only because they need a medical doctor, but can we get them something that's actually going to help them and cut the cost, and they can say, hey, you know what? This facility does save money for me. The average facility, the average family of 4 in my facility probably will save anywhere from $250 to $1,000 a year, just because they do not have to go to an urgent care ER and pay those higher copays. So what I wanted was, the only way this can be more successful is if I can grow and I can bring those services. So I started off. I built a 9,000 square foot facility when everyone would have said, you're nuts. You know, why wouldn't you take a 2,000 square foot facility? Scott Boyd was having lakeside village development, and I took that space. But you know, one of the things also was, just like earlier, Scott Boyd had a vision. He's building Hamlin because he has a vision to give something to the community, not because he's a housing development. It's because we need to create a community, give them all the things that they need, the medical facilities, the schools, the publics that they need for shopping. We have the first gas station on 535, whereas I had to drive 8 miles before. So at the end, it really comes down to is if we're going to create something, we got to create something that's going to really matter to the patient. And I think that taking that leap of faith was, I have no regrets. It's harder than you can ever imagine, but I have no regrets, and I feel like I've really made an impact. We've had more than 30,000 visits in the last year, but I do know my patients now get it. There is somebody looking out for them, and I will continue to do this until they can.
Well, all right, let's move on to the